of the diabetic patients are suffering from neuropathic pain. What is the root cause for it? What can you do to prevent neuropathy? What are the available treatments? Today we are going to talk about all these. Welcome everyone. I am Dr. Harathi Bandaru. As per American Diabetic Association, diabetic neuropathy is because of direct damage to the nerves secondary to elevated blood glucose levels. That's the reason why the symptoms are dull aching pain, pins and needles, burning feet, electric shock like sensation, and on the top it affects the longest nerves of your body. Where do you see the longest nerves? In your feet and legs. That's why you see more symptoms starting in the feet and legs first than in any parts of the body. On the top, you see these symptoms more during the night time. So what is the root cause? As you all know, the root cause is elevated blood glucose level and uncontrolled diabetes. So what do? You have to control your hemoglobin A1C less than 7%. It's very, very important. And what are the other root causes? In order to promote nerve healing, you need some cofactors, especially vitamin B1, thiamine, and alpha lipoic acid play a very important role. So if your levels are low, make sure you take vitamin B1 and alpha lipoic acid. And one more important thing is diabetic patients, most of the diabetic patients, they are low in vitamin B12 because many of them use metformin and acid blocker medications like omeprazole. These medications decrease the absorption of vitamin B12, thereby you'll get vitamin B12 deficiency. And you need vitamin B12 for myelin formation of your nerve. So if you don't have that, you will get neuropathy. So make sure you check the levels. If the levels are low, you replace it. That's very easy to do it. What are the other important factors that you can do from your end to prevent neuropathy? As per Stanford research, they found out that most of the diabetic patients who take snacks every 2 to 3 hours are more prone for neuropathy. So avoid snacking. Please give at least 12-hour gap between your dinner and breakfast so that your body can heal. Sometimes if you can give at least like 12 to 16 hours, whichever is comfortable for you. Why constant snacking causes nerve damage? Constant snacking increases the blood glucose level, thereby insulin shoots up to lower the blood glucose level. So there is no time to heal your body, thereby causing nerve damage. Number 2, always eat carbs along with good protein and quality fats. Eating carbs alone, they are more prone for neuropathy when compared to the other patient as per American Diabetic Association. That's why pair your carbs with good protein like chicken, paneer, tofu, eggs, along with healthy fats like almonds, walnuts. They really help you a lot. In addition to that, also make sure, as per John Hopkinson's research, make sure you're not deficient in vitamin B12. If you take care of all that, you can prevent neuropathy from your end to some extent. What are the treatment options available? So first, start with good natural supplement because everyone wants natural treatments first. So start with phenphothymine, 400 mg daily, vitamin B12 supplements if you are not having enough vitamin B12, alpha lipoic acid 400 to 600 mg daily, and you see how you are doing. If you are not happy and if you still have neuropathic pain, then start real medications like duloxetine, FDA approved for diabetic neuropathy, and pregabalin, it's also approved, and start with lower doses and increase as tolerated. Don't never start with higher doses. Why? Because you're going to get side effect. That's why start with the lower doses under your physician's supervision, and obviously when you go up slowly and everything will be smooth and sweet. In addition to that, also try TENS units, trans-electrical nerve stimulation. It helped some of the patients and it is available on Amazon. Make sure you do good physical therapy and balance exercises. And you can also try topical treatments like capsaicin cream or neuropathic foot pain relief cream. Again, they are all available over the counter or Amazon. And you can also try lidocaine patches for localized pain. It helped some of the patients. If you do all these measures consistently, and if you control your blood pressure, cholesterol, weight, and if you control your diabetes, and if you take care of yourself, and if you do stretching exercise, you are winning this race and you are saving your nerves. If you find this video useful, do subscribe, share, comment. Thank you so much.